Hi guys, welcome back to my channel, and if you are new, hey, my name is doesnt and I'm a qualified registered nurse in South Africa. I'm here to document my life as a South African nurse. So if that's the type of content you would like to enjoy, please do hit the subscribe button and join. This is Nursesia. Yeah, I am doing a get to know me test. Right, so Malabucho will be doing the reading of questions because I was getting distracted. She is right behind me, but you guys can't see her.
Introduction.
My name is doesnt, so I'm a 30-year-old qualified registered nurse. I've been working as a nurse for 5 years now, and I'm in Rustenburg in Northwest. I wouldn't say I chose nursing, but rather nursing chose me, or I didn't know that I was choosing nursing. But I always wanted to be a medical doctor. I would describe it in a way that it was actually nursing that I wanted to do, but because I was young and I never had the opportunity of take a girl child to work where a doctor takes me to work or a nurse takes me to work. But as soon as I started practicing, like doing my practicals as a student, and also as soon as I started working, I realized that from childhood it's nursing that I always wanted to do. It was never medicine. I just didn't know how to title it, but because doctors were famous, people never spoke about nurses then, so I guess I used the word doctor, but I'd never be a medical doctor. Right, nursing. What I love the most about the role that I'm in right now, for those who are new here, I am an HIV prevention nurse, and what I love the most about it is anyone who knows me knows I'm passionate about HIV. So to have an opportunity to stop it from spreading amongst my people, and by my people I mean like black people, that for me it's an honor. That's what I love the most, the fact that I am actually contributing in making sure that we are eradicating HIV in the country. What I would say to aspiring nurses is go for it. Often you hear us as qualified nurses, you guys will hear Malebu and her cup and stuff, but please don't worry about that. You will hear us complaining that we are not paid enough, we are working long hours, we are not appreciated. You will read a lot of complaints about nurses, and probably you will read less appreciative posts on social media about nurses. You will read every negativity about a nurse. Don't let that discourage you. If you feel it in your heart, if you know it in your heart, in your bone marrow, that it is nursing that you want, that it is making people feel good about themselves that you want, if you definitely know, don't listen to the external forces that discourages a lot of people from getting into the profession. Go for it, and also don't let your background stand in your way of accomplishing your dreams. Don't let you not having money for fees stand in your way. This morning Malibu and I were actually speaking about how we need to advance in the profession, and that will also happen by us studying. And we were both giving like examples of people who had to go through extreme measures to make sure that they study and qualify to be something. So even you, if it means you must go wash cars, or if it means you must go sell at the street corner for you to be able to have money to take yourself to school, please do that. Don't give up. Go on and get your dreams, honey. Like I said, I am an HIV nurse, so that's what I'm doing, and that's something that I would further like to study on. What I found rewarding about my job, oh my goodness, like it is a thank you from someone that will never be able to do anything for you. When a client says thank you from the bottom of their heart, that for me, it is so rewarding, it is so fulfilling, to a point where I would do my job without getting paid. That's if I didn't have any bills to pay. But yeah, a thank you from someone whom you cannot do anything for. Most of the people that I serve, in my work capacity and on my personal capacity, they are people who can't buy me cars, they can't buy me expensive gifts to say thank you. So hearing them saying it, knowing that it comes from the bottom of their hearts, that for me is rewarding. In South Africa, we all know that nurses are not highly paid. Yeah, I don't think we are fairly paid in South Africa. Actually, in Africa as a whole, which is the reason that a lot of nurses would rather leave and actually go work international or abroad, because they are looking for better salaries. And secondly, what I do not like about nursing in South Africa, or the challenges that we have, it is the nurse-patient relationship. And by nurse-patient, I'm also including the relatives of the patients. Often at the hospitals, nurses who are at the hospitals are complaining about the patient's relatives, or some are complaining about the patients, and also the patients and the relatives are also complaining about nurses. I wish that is something that can be changed in the country, or something that can improve. And the only way for it to improve, to be honest, is if there is enough resources in a health establishment. Because if there are enough nurses, then obviously nurse A will never be in her field. She won't be overworked, and it will mean she will enjoy what she's doing. If a nurse enjoys what they're doing, if they enjoy their work, I don't think they will have any attitude towards their patients. And also, I think one thing that makes patients to be restless, or their family members, is the type of services they might be getting in the health establishment, which are compromised by the lack of resources. So some of these things are actually things that can be sorted out by our own government. Also, the nurse's salary is something that can be sorted out by our own government. Corona has done a lot. It has inflicted a lot of mental ills in a lot of healthcare workers. I remember at the beginning of lockdown last year, we were all terrified, and I remember there was a day I was driving to work. I think I was even vlogging on that day, and it was so clean on the streets. Literally, being a front line worker, it ain't fun. It was so clean on the streets, like people were not going to work, and it was only us who are regarded as essential service workers who were to go to work. So that alone, when there is a monster and everybody is being told to stay in their houses, Bomalebu were staying in their houses because their working was for people who have money. But for us, everybody is being told to stay away in their houses, and then they were like, yeah, you guys go. Imagine, like, that was terrifying. I think I'm not the only person who felt that way, but I felt like we were being sent to war, and we were not well equipped, because we didn't know what we were dealing with. We didn't know what COVID was, and at that particular time, not that it has stopped now, but it was killing people rapidly. And have to record the number of deaths in a day in South Africa, that was horrific to watch. And knowing that my workplace is a place where I can actually contract COVID, that was also terrifying. The other terrifying thing for me was the fact that I don't stay with my parents. Like, I stay in a very far province from where they are. So I was locked in this province. I couldn't even travel home to see my daughter and my parents. That was also very stressful for me. So it affected me mentally more than it did physically, because I don't think I've had COVID. Well, you'll never know, right? Because we've had flus, but we never went and tested. So yeah, it has affected me mentally than in any other way. You know what I've realized, the reason the community doesn't respect us, and the reason the community always sees us as bad people, is because the media, like when I'm saying the media, I'm talking about the mainstream as well as social media. They are quick to trend all the negative things about nurses. But this morning, actually, I woke up to a post made by a lady who is appreciating Tembisa Hospital. We all know, like, I've never been to Tembisa, but I've known Tembisa from the media to be the most horrible hospital in the country. But from what that lady said today on that post, I realized that there are a lot of clients who are getting good services in our healthcare establishments, but they don't go out and publish it. One negative thing that a client experiences in a healthcare establishment, they are quick to go and report that. The very same person who posted nicely about Tembisa today, at least she did post. But if she hadn't posted and she would experience something negative in the future, people would only know about the negativity of Tembisa, but they wouldn't know about all these months that she's been going to Tembisa and getting good service. So it does really affect us, because even our clients, they come into our health establishment with attitudes, knowing that we are said to be rude. You know, even people who don't go to clinics, they know that nurses are rude. People who have never interacted with nurses or doctors in a healthcare establishment, they know that we are said to be rude. So they approach us with that attitude of knowing that they're gonna receive rudeness from us. So I would highly appreciate it if you go to a public health establishment and you actually write a good review. If you get good services, publish those good services. Let us also flood the social medias as well as the mainstream media about the good interactions that you are getting from nurses and doctors. What you need to understand about nursing, you guys, is that we follow protocols, rules, and guidelines. We don't do as we please. I would love to give you Disprin for your headache, but the guideline doesn't say that. It doesn't say I must give you Disprin. So don't come into my consulting room saying you want Disprin for your headache. No, that's not what the guideline says. That's not what EDL says. And if I give you the aspirin and something happens to you, I'm the one who's going to lose my license. And the other thing is, when it comes to understanding that we actually work with guidelines, you guys get in healthcare establishment, especially the public sector healthcare establishment, and you feel Ukba, you don't want to queue because you are who and who. It doesn't work like that, honey. Like, there is what we call triage in the public hospitals. So triage gives us the critic state of a client. We start with clients who are critical. In your health centers and your clinics, elderly people, we start with elderly people. They're not supposed to queue. They don't queue in banks. Why do we want them to queue in the clinics? It's not something that we, the nurses, came up with. It's a law that has been set by the South African government. These are guidelines that are not created by us, the workforce that is on the field. They are created by people up there, and there's absolutely nothing we can do about it. If we break them, we're breaking the law and we can get in trouble. My most memorable nursing moment, I think I've shared it here. It was when a 55-year-old male cried and I had to literally like reach for a tissue from my handbag. And I think I was 25 years old at that time. It was my first year working as a nurse. So this man comes into my consulting room wheeling his wife on a wheelchair, and the wife was critically ill, and I was an HIV and chronic nurse then. So the wife was critically ill, and I was just taking my history and stuff like that, and something just said to me, ask the man how he's doing. And I was like, Papa, how are you doing? And the man started crying. So that to me made me to realize that the patient is not always the person that is sick. Sometimes even the people that are accompanying this patient, they are carrying a lot of burdens. So you should always practice kindness. You should always practice goodness to people. And just by asking that man how he was, and he started crying, telling me how difficult it was to nurse his wife, because his children were not involved, his family members were not involved, and it was just him and his wife, and it was taking an emotional and mental strain. So that was a memorable moment for me, a moment that I am unable to erase in my mind, but also it is a beautiful memory. Guys, those are the questions that I wanted to ask on this particular Get to Know Me tag. I hope it really does gives you a view of myself and my beliefs when it comes to my profession. So if you enjoyed the video, don't forget to give it a massive thumbs up and comment down below anything really that you would like to know about me that I might have not said it on here, and subscribe if you're new. I'll see you on my next one, and say thank you to Malibu for being our behind the scenes voice. Bye.
Bye. Bye. Bye. Thank you.